The views and opinions expressed on America's Workforce Union podcast and its digital media channels are solely those of the speakers and do not necessarily represent the views and opinions of the producers or sponsors.
Welcome to the America's Workforce Radio Podcast, the flagship production of the American Workers Radio and Podcast Network, where organized labor and its never-ending fight to protect the rights of the American worker come first. Now, presented by LIUNA, Laborers International Union of North America. Here's your host, Ed Flash Ferens.
So what about those tariffs? What have they accomplished? Well, in one word, layoffs. The Department of Labor recognizing Workers' Memorial Day. And today on the show, we check in with National Nurses United and the National Labor Office of Blue Cross and Blue Shield. Welcome to the Thursday, April 24th edition of America's Workforce, where we are available on at least 5 platforms, including YouTube, Apple Podcasts, iHeartRadio, Spotify, and Pandora. We have 2 guests on the show today. We're going to start things off with Cathy Kennedy. Cathy is president of National Nurses United. NationalNursesUnited.org is the website. And in fact, she is one of 4 presidents of National Nurses United. They have a council of 4 presidents, along with an executive director. The 4 presidents, along with Cathy, are Nancy Hagans, Jamie Brown, and Mary Turner. Well, we've been talking a whole lot about the nursing profession on this show and the short staffing that so many nurses encounter on the job. And it's only going to get worse because the Department of Health and Human Services, as you well know, under attack with the Trump administration, making massive layoffs across the department, including the Centers for Disease Control and Prevention and NIOSH. We talked about this a couple of days on the show. That's the National Institute for Occupational Safety and Health. The administration also wants to cut over $800 billion from Medicaid. We'll get into that. We'll talk about Medicare for all. We'll talk about union rights under attack. And a little background on Cathy. She's been around a while. She's a registered nurse, member of the Council of Presidents, again, of National Nurses United. And they are, by the way, the largest and fastest growing union with more than 225,000 members nationwide. A lot of states with chapters of National Nurses United. She started the profession 45 years ago. And she's also volunteered with NNU's Registered Nurse Response Network, a disaster relief project of the California Nurses Foundation. She is engaged in domestic and global natural disaster and humanitarian relief missions for more than 15 years. If you go back to 2017, Cathy Kennedy led a deployment of 50 volunteers, RNs, to Puerto Rico in the aftermath of Hurricane Maria. And during the COVID-19 pandemic, she continued to speak out for patient and nurse protections. And her voice was featured in major outlets like The Guardian, BuzzFeed, Yahoo News, the LA Times, and now America's Workforce. We appreciate that. NationalNursesUnited.org. And also, we've been talking about the staff cuts at the VA. There's a lot of nurses that represent VA centers, along with the American Federation of Government Employees. And she's going to discuss that as well. So Cathy Kennedy will be our first guest. Then we're going to go to Merrilee Logue. Merrilee is the executive director of one of our great sponsors here on the show. That's the National Labor Office at Blue Cross and Blue Shield. And we are going to talk about cancer. So many people have been touched by cancer, and we'll get into some of the facts. Last year, according to the National Institute for Health, over 2 million new cases of cancer were diagnosed in the U.S. alone. And how about this? 42% of those newly diagnosed cancers are potentially avoidable. What we're going to talk about is preventive care and making sure you detect that cancer early. And you know what? This just reminds me of a podcast we did yesterday with Color Health. And we had two really, really bright individuals on the line with us. It was the Director of Labor and Trust Sales at Color Health, Tyler Lefebvre, and Maria Sheeler, who's a fund administrator with the Teamsters. And they were talking about how the unions have partnered with Color Health, and they have a virtual cancer clinic. And this was mind-boggling to me because you could use genetics today, a saliva test, to see whether or not you are susceptible to cancer. It's amazing. It's amazing. And they have a virtual cancer clinic. If you missed it, just go to awfpodcast.com. All right, now a brief look into the world of labor. This segment brought to you by Boyd Watterson Asset Management. You can find more at boydwatterson.com. Donald Trump's tariffs are already triggering thousands of layoffs in various American manufacturing plants, mostly in the Midwest and the East. The Volvo Group has announced it is cutting 800 workers at its Volvo and Mack truck plants in Pennsylvania, Virginia, and Maryland. According to a spokesperson, heavy-duty truck orders continue to be negatively affected by market uncertainty. Pennsylvania Democratic state lawmaker Josh Siegel said the tariffs have been a devastating blow to Lehigh Valley workers in a region where Mack remains one of the largest employers. He said workers are not just numbers. They're parents, neighbors, veterans, and skilled tradespeople who have built America's backbone. Boy, is he right about that. Earlier this month, Stellantis, which makes a variety of vehicles, announced it was laying off 900 employees at plants in Michigan and Indiana after the company paused production at some of its Canadian and Mexican assembly operations. Steelmaker Cleveland-Cliffs laid off more than 1,200 workers in Michigan and Minnesota. And General Motors announced earlier this month it would temporarily lay off 200 workers at a plant in Detroit. Ro Khanna, California Democratic representative, who we have had on the show several times, claimed earlier this month that more than 4,100 factory workers have been laid off across the U.S. because of those tariffs. Now, Goldman Sachs noted last week in a report that the president's tariffs would likely create about 1,000 manufacturing jobs, but at the same time, kill about 500,000 jobs across all industries. So what does that tell you? In addition, business owners are reluctant to make massive investment in a new plant. Now, this week, Trump kind of toned everything down, and it sounds like a lot of those tariffs will be coming off. We'll see what happens here. The U.S. Department of Labor today honored workers whose jobs have claimed their lives during their National Workers Memorial Day program. The department welcomed families traveling from around the country to the nation's capital for the program, which pays tribute to men and women who have lost their lives while on the job, as well as all the fallen workers before them and the survivors who remain. Today, work-related injuries in this country claim about 15 people's lives per day. And if you go back to 2023, there was a reported 5,285 workers suffering fatal injuries on the job. U.S. Secretary of Labor Lori Chavez-DeRemer, Occupational Safety and Health Administration Acting Assistant Secretary Amanda Wood-Lehau, and Mine Safety and Health Administration Deputy Assistant Secretary for Policy James McHugh spoke during this year's Worker Memorial Day ceremony, which was held at the department's Washington headquarters. Now, the actual day is this coming Monday. Workers' Memorial Day is observed on April 28th with local observances across the country that bring together workers, families, and unions in a shared commitment to preventing workplace hazards so that every worker can return home safely at the end of the day. That's what we want. Now, that date also marks a significant milestone in workplace safety. It's the anniversary of the Occupational Safety and Health Administration, which opened its doors in 1971 following the passage of the Occupational Safety and Health Act of 1970. And I want to call attention to National COSH, National Council of Occupational Safety and Health. Today, they released their Dirty Dozen employers. They do this every year. It's kind of a shaming of the companies that really don't pay attention to worker safety. And frankly, there's a whole lot more than a dozen, but these are the Dirty Dozen. Just Google NCOSH for all that information. All right, we're going to take a quick break. When we come back, the president, or at least one of the presidents of National Nurses United, Cathy Kennedy, will be joining us on America's Workforce. Don't go away.
You're listening to America's Workforce with Ed Flash Ferens.
America's Workforce is presented by the Laborers International Union of North America. Feel the power right now at liuna.org.
America's Workforce is sponsored in part by Boyd Watterson Asset Management, LLC. Find out more about our investment solutions tailored to meet the needs of Taft-Hartley funds at boydwatterson.com.
It takes LIUNA to power North America with affordable energy. The men and women of LIUNA, the Laborers International Union of North America, have the skills needed to build and maintain oil, natural gas, nuclear, solar, and wind projects that are shaping America's energy future. From new energy tech to retrofitted facilities, LIUNA members do it all. Find out what it takes to be powered by LIUNA at liuna.org. That's liuna.org.
This segment of the show is brought to you by the Brotherhood of Maintenance of Way Employees Division of the International Brotherhood of Teamsters. For more information, please visit bmwe.org.
There is unity and strength for workers.
We are the USW.
We are the USW.
The United Steelworkers.
The largest industrial union in North America.
We represent 850,000 members in the U.S., Canada, and the Caribbean.
We work in metals,
rubber,
chemicals,
paper,
oil refining,
atomic energy, and the service sector.
We are steelworkers, standing strong and fighting for what's right.
America's Workforce is brought to you in part by the International Federation of Professional and Technical Engineers. You can find more at ifpte.org.
American workers are sick of struggling to get by. It's time to get ahead. In the Teamsters Union, workers are winning industry-leading contracts, historically high wages, fully paid health care, and retirement benefits you can count on. Across the country, Teamsters fight alongside our brothers and sisters to secure a better life. It's what we've been doing and how we've been living for more than a century. When we fight, we win. Join us. Be a Teamster.
Now, back to America's Workforce. Here's Ed Flash Ferens.
And remember, you can check us out on Facebook or follow us on X, formerly known as Twitter. That would be AWF Union Podcast, AWF Union Podcast. Let's go to our featured guest today. And I talk a whole lot on this show about nurses, especially National Nurses United, which is a large union, and they're spread across the United States. It started out in California some years ago. NationalNursesUnited.org is the website to go to. National Nurses United. And joining us on our live line right now is someone who's got a lot of experience in nursing going back, my gosh, more than 4 decades, and that would be Cathy Kennedy, who serves as president of National Nurses United. Cathy, thanks for joining us here on America's Workforce. And I tell you, like I said, we've been talking a whole lot about staffing ratios, violence on the job by patients. I saw the story where one nurse a couple of years ago in Eastern Connecticut was murdered on the job during a solo home health visit to an extremely high-risk patient that had a criminal history. You just don't know what you're walking into, but
you don't.
We need protections for nurses, and that's just one of the things we're going to get into. Plus, I want to talk about Medicare for all. But you know what? This is a get acquainted session. Cathy, why did you enter this field? You knew there were challenges going in, I'm sure, but let's start right there, if you don't mind. Go ahead.
Yeah, absolutely. Well, thank you so very much for having me today. And I've been a nurse, God, since 1980. So I'm talking 45 years. And, I think that I went into nursing. My father's in the military, and I'm biracial. So I'm half Japanese, half Black. And I was in Japan back in the 60s as a young girl and saw a lot of the men coming through from Vietnam. So I was very aware of the Vietnam War back then. And in the back of my mind, it was either going to be a teacher or a nurse. And so the decision was made in 1980 when I graduated from nursing school, and I've been a nurse ever since. So 45 years of nursing. Yes. Wanted to help people.
And Cathy, how long have you been president of National Nurses United?
I just became president this last term. So 2023, I became one of the presidents of National Nurses United. I'm currently also president of the California Nurse Association National Nurses Organizing Committee. So I've been president for California for about 6 years now, and just started my first term as president.
I know California has been very instrumental, and it's important that other states follow the lead here when it comes to ratios, nurse-to-patient ratios. If you don't mind, can you reflect on what happened, how you made that happen, and how much it has spread to other states? Can you get into that?
Sure. So, like I said, I started my career back in 1980, and, we had critical care ratios in the 70s here in California. And one of the things that we recognized is that, without the proper nurse to patient ratios, patients' outcomes were really not good. They did several studies. And so California's CNA really began to look at expanding the ratio, nurse to patient ratio, throughout our state. And we began to talk to legislators. And this took a good 20 some odd years. When I first started off as a nurse, I was a med-surg nurse. So it was not unusual for me to have anywhere between 8 to even 24 patients at a time. I think the maximum that I had when I was a night shift nurse in San Francisco was like 24 patients. Patients weren't as sick as they are now, but nevertheless, it was impossible to try to make sure that you could touch each patient in an 8-hour period. We continued to lobby, argue, and provide studies to the legislators in the state of California. And finally, we got it passed when Governor Gray Davis was in office. And it became enacted and in place by 2003, I believe. So we've been very fortunate to have the ratios for the last 20 years. And it has made a significant difference. Back then, the hospital really lobbied hard against the ratio law because they said, where are we going to find the nurses? Well, nurses left the bedside because it was so horrific. Couldn't provide the care, patients' outcomes were terrible. But we really said, nurses want to work at the bedside, but they want to make sure that the work environment was such that they didn't leave going home crying every night because they didn't provide the care that they should have been providing. And, once we got that law enacted and in place, nurses did come back. And we made a huge difference. And so knowing that, that California is not an island, one of the things that we are doing nationally is we feel that, the patients are no different on the West Coast, on the East Coast, and in the Midwest. And so it's very important for people to understand, to provide that education to them that we want our patients' outcomes to be better. And the only way that we can do that is to actually have a national nurse to patient ratio. And so we've been knocking on doors, talking to our legislators federally and really trying to push that. And other states individually are trying to enact the laws. It's still an ongoing process. I know New York has one. It hasn't been implemented yet, but the law was passed. So they're working those elements of what does it look like for them, for the state of New York. and other states. So, states are trying very hard, but I think that if we have something nationally, it will just make it so much easier for the nurses and patients alike.
Yeah, a national standard would really be good.
Yes.
Let's talk about staffing it at the VA now. And we've been talking about this a whole lot here on the show because, and some of us seen this coming as far as cutbacks, not as drastic perhaps.
Mm-hmm.
And from what we've been gathering, one of our partners here on the show is the American Federation of Government Employees, which represents a lot of workers in the federal government, including the Veterans Administration. And I know National Nurses United also working at VA facilities.
Yes.
Now, it's my understanding that they actually need more workers at the VA. And instead, they're going in the opposite direction. I'm hearing numbers up to 80,000 workers might be cut, many of them veterans caring for other veterans. That's what it's all about.
Yes.
So I know you are among the vocal unions. Maybe you could speak to that to our listeners here on the show, because this should not be happening. Cathy, go ahead.
Absolutely not. We are really trying to continue to educate the public about what exactly the VA nurses provide for our veterans. I mean, these are young men and women that have served, for our countries. And so, we really need to let people know and understand that what the VA does, it's the only health system in the country that actually offers this real holistic approach to healthcare for our veterans, whether it's transportation to get to and from their clinic appointments, caregiver support, clothing allowances, providing family caregivers relief support. And so these are things that I don't think people really understand. And, just trying to get more VA nurses into our hospitals has been something that has been something that they haven't been doing in a long time. And so now, what the real plan is they want to try to not only cut those jobs, but really try to privatize it. So that's what they're trying to do is, while the VA can provide these services, they still need the additional support. But, this particular administration is really trying to cut everything that they can to show that the veterans are not really getting what they need in the VA hospital. So therefore, we need to privatize it, send them out to, the private sector, again, and then, really making it so much harder for our veterans. And so we're trying to put a spotlight on this, that it is, really important for people to understand that, they're continuing to cut, the VA, and it's already cut down to, the bare minimum. They've cut away their union protections, and they're really demoralizing these people, our nurses, as well as other government employees, federal employees. So we're trying to put a spotlight on that.
Yeah. All the federal unions are under attack. In fact, there's some legislation that was introduced not too long ago by some members, far-right members of Congress in the Senate, I believe. They want to do away with federal unions altogether, federal, public sector unions. And
yes.
And some states have also gone in that direction. Let me ask you this, Cathy. You've been around a long time. As you said, you started in nursing back in 1980. How does this affect you personally with what's going on with this administration? I mean, you understood what Trump did in the first round.
Yeah.
And it seems like with Project 2025 in play, and that's exactly what's in play right now, this one seems to be over the top. Do you feel pretty much the same?
I do, because again, I'm greater than 65 years old, and recognizing that I have worked, my entire life. And so now, I would like to, receive Social Security. These are things that everybody pays into. And when you turn 65, you are able to then, receive a Social Security check, and it will help alleviate some of the costs that, as a senior citizen, you expect that money to come back to you. And what this administration wants to do, and I'm also, eligible for Medicare. which I'm entitled to.
Mm-hmm.
And this administration really wants to cut, severe cuts to Medicaid, Medicare, Social Security. We're talking about $880 billion to provide a tax cut for billionaires. This is insane. It's ridiculous. And all of the things that this administration wants to do really affects, our senior citizens. I'm one of them, low-income families, people with disabilities, and veterans. All will suffer. And, I think that people really need to understand what's going on here. My husband and I, we have a son that is disabled. He was born visually impaired, and he has cerebral palsy. And it's through, Medicaid that has provided my son and us the support that we need to provide care for him. To think about that going away it's a big concern for me personally, but I also, as a nurse, thinking about, the millions of people in the United States that would suffer.
Yeah.
And it's devastating.
And think about this, Cathy. You are one person with that. There's many more just like you in America, and they're worried. They're worried about the future right now.
Absolutely.
Cathy Kennedy joining us on our live line today as our featured guest. She is the president of National Nurses United. Do check out their website. Very proactive website. I check it just about every day here as I prep for America's Workforce. nationalnursesunited.org. Lots more to talk about. I want to get into Medicare for All, and also the Workplace Violence Prevention Act. Hopefully that'll go somewhere in this Congress. I'm not holding my breath, but it's important that we talk about it. We'll be back in a few minutes. You're listening to America's Workforce.
This is America's Workforce.
Millwood, advancing economic independence for workers with disabilities for more than 60 years. Learn more by visiting millwood.org.
It takes LIUNA to keep America running. Over 70,000 public employees are part of LIUNA, the Laborers International Union of North America, delivering critical services such as healthcare and emergency response, as well as maintaining roads and sanitation systems. Even the National Postal Mail Handlers Union, representing over 47,000 U.S. postal workers, is affiliated with LIUNA. Find out what it takes for LIUNA to keep America running at liuna.org. That's liuna.org.
America's Workforce is brought to you in part by the United Steelworkers. You can find more at usw.org.
America's Workforce Radio is sponsored in part by the International Union of Painters and Allied Trades, District Council 6, representing painters, glazers, drywall finishers, and sign and display industry workers. They remind you that belonging to a union is your right as an American.
Unions are organizing all across America. New units are being formed and existing units are getting stronger. It's never been a more important or a more challenging job. Broadstripes is here to help you do it. Broadstripes is an all-in-one communication and organizing tool. Unions of all sizes rely on us, from nationals like LIUNA and Unite Here to locals throughout the U.S. and Canada. With Broadstripes, you can text and email your members, create digital membership cards, identify leaders, and build the power you need to win. Check us out at broadstripes.com.
Now, back to Ed Flash Ferens with America's Workforce.
And don't forget, you can check us out on at least 5 platforms. That includes YouTube, Apple Podcasts, iHeartRadio, Spotify, and Pandora. And when you get an opportunity, here's what you do. Just sign up and receive our shows on a regular basis and give us a rating. We always appreciate those 5-star ratings. And if you like a show like this one, love talking to the nurses, just share that show. awfpodcast.com. Just supply the link and spread the good news around, especially what unions are doing, especially now in America. Cathy Kennedy, our featured guest today. She is president of National Nurses United. The website to go to, nationalnursesunited.org. Cathy, I really appreciate your time here on America's Workforce.
Sure.
And there's a couple more issues here I want to get into. We've got Workers' Memorial Day on Monday. And I saw the story on the AFL-CIO website, NIOSH, that's a National Institute for Occupational Safety and Health, and how they're cutting back. I mean, we're seeing chop, 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 and we're talking about people's lives here. I mean, there is a reason regulations are in place. We all know that. And now they seem to be going away. So workplaces are going to be less safe. There's a good chance more people will be dying on the job every day. I say this so many times on the show, about 15, 16 people don't make it home from work. Something happened at work and they lost their life. So how is this? I mean, being in a nursing profession, I mean, you take this personally. You want people to live long and healthy lives here. Mm-hmm. And I want to talk about what National Nurses United is doing. I mean, we got this show to get the message out that this is the wrong way to go. What do you say to that?
Well, I absolutely agree with you. I mean, like I said, I've been a nurse for over 45 years, and there's not a day that I don't think about making sure that not only my patients are safe, but as a healthcare worker, as a registered nurse, I want to make sure that my work environment protects me. The employer is protecting, the nurses, the patients, and the staff on a daily basis. And so, these are things that I don't even know if people really understand what we do. I mean, mental health issues are on the rise. There's not enough services for our mental health patients. And so therefore you actually see those in different patient population areas. And so it really puts, all of us at risk. And so one of the things that we have been doing for many, many years, and again, in the state of California, we press that issue, and nationally, we are pressing the issue to ensure that, there are workplace violence protections in place so that nurses, doctors can do what they need to do without having to worry about making sure that they're safe and they're able to go home with their families. Mm-hmm. And so we are pushing this issue nationally.
Yeah, especially for healthcare workers. I mentioned earlier on about the one nurse who was killed in Connecticut a couple of years ago. Yeah. And patients, you just don't know what you're dealing with. So if you don't mind, can we speak to that? I know it was reintroduced recently, mm-hmm. and we're talking about the Workplace Violence Prevention for Healthcare and Social Service Workers Act. I understand it's got bipartisan support. Where are we with it right now, Cathy? Is there any movement on it?
Well, we do, it was introduced. And so again, this is something that we actually are getting ready to have a federal lobby day, and we're going to be going to Washington, D.C. at the end of this month. And this is one of the things that we feel is extremely important across the nation. This has been sponsored by Senator Tammy Baldwin and Representative, it's S 1176 and HR 2663 with Representative Courtney. And, again, recognizing that working in the hospitals and clinic settings, you never know what's going to happen. I mean, we really want to make sure that when we enter into, whether it's a hospital or a clinic, that the area is safe, and that even our patients, when they come in, that they can feel safe without having to think that somebody's going to come through and do harm to them. And so it is really important for people and the legislators to understand that we need to make sure that there are safety measures put in place so that we can be assured that, again, we're able to provide the care that we need, that we have the correct people, the behavioralists, the psychiatrists, all of that in place. It's just very important for them to really understand that. And so we're going to continue to push. I mean, one of the things that I can say about National Nurses United is that we continue to speak, truth to power, to really explain to the legislators that this is something important, and we need to make sure that they understand that, that they are protecting not only the workers, but also the patients. And so we're going to continue to push and make sure that this happens nationally. In California, we've been fortunate enough to have workplace violence protection in place. It is now law. And so hospitals have a responsibility, to do the risk assessment, to make sure that you have the correct security in place. So that is happening. And even then, we still have, cracks that happen and things do happen, but we do have that in place in California.
Sure.
And as I said before, we need to have it nationally.
Well, the data speaks volumes. I'm looking at a February 2024 survey, 8 in 10 nurses, actually over that amount, 81.6% have experienced at least one type of workplace violence within the past year. And half the nurses, nearly half, 45.5%, reported an increase in workplace violence in their units in the previous year.
Mm-hmm.
So we have a problem. Here's my concern, because I was reading on what you would like to see in that legislation. It requires federal OSHA to create a federal workplace violence prevention standard. And Cathy, there's some people in Washington that don't like OSHA. Some would like to see it go away. I think that's going to complicate things a little more right now, don't you think?
I do. Under NIOSH, the National Institute of Occupational Safety and Health, is part of the CDC, Centers for Disease Control and Prevention. They're already talking about at least 20,000 workers, 90% of NIOSH staff being cut. And so these are people that are in place that really look at, research and how to prevent, things from happening, making sure that we're safe. I think about the N95 respirators that we used during COVID. This is part of NIOSH. Really making sure that, the masks that we used during COVID were really effective and that it prevented, healthcare workers, nurses from, contracting COVID and dying. We lost a lot of people during COVID. And NIOSH was the place where they made sure that every piece of equipment is appropriate and provide safety for its worker. And it's not just healthcare workers. You're also talking about construction and manufacturing. So this affects a whole lot of people. And so to see the cuts from NIOSH of more than 20,000 workers, that's not what we need to see happen.
No.
And so really, it feels as though they want us to say, you're kind of on your own, good luck.
Yeah.
And that's not what we should be.
No. Government is kind of like your silent friend when you think about it, because you hear, oh, it's a government worker. They're demonized all the time, especially now. And people don't realize, and they will not realize the effects of what's going on right now until maybe a couple of months. Some of them are already, the long lines at Social Security, there's a good example right there. You can't even get through on a phone in 4 hours.
Yes.
So they're feeling the pinch right now. And America, let's be honest, is starting to speak out, which is a good thing. We just have to continue to do that. You know what? I got one more question here for you, and I appreciate your time. Again, we're speaking with Cathy Kennedy, who is the president of National Nurses United. The website, nationalnursesunited.org. You can find a whole lot of information on what we're talking about on that website. Medicare for all. We all know, Cathy, how much healthcare has been costing us. Thankfully, with the unions, they negotiate the best package possible for their members. But there's a lot of people that are not in a union. Let's be honest about that.
Yeah.
This would change the dynamics.
Yes, it would.
And I know National Nurses United has been very, very proactive on this issue. What do you see happening here? Are we going to see some movement here or what?
Well, you know what? Again, this is something that we, as a nurse, we really believe, well, not just nurses. So, I'm just saying that healthcare is a human right. It shouldn't be for the privileged. And so, for me as a nurse of over 45 years, I don't know who's who when they walk through the doors. I just want to provide care. And that's how nurses, physicians feel. And what we're seeing now is that these huge healthcare corporations, it's about the profits, it's about the shareholders, and not about the patients. And so this is something that we have been purporting for many, many years. And there is such a groundswell right now that people are seeing that, they can't make even, they have to make those decisions on, do I go to the clinic to see the doctor, or am I going to pay for rent? And that should never happen. And like you said, the majority of workers in the country depend on their employers for their health care. And if for some reason they lose their jobs, they're without health care. So the only way that they can get care is they have to wait until they get extremely sick and enter in through the emergency room. And there's no reason for that. we're the richest country in the world, but we have the worst outcomes. I think we might be 38, 39 as far as outcomes. And that really is ridiculous. And so people are now recognizing the importance of having health care. And so there is this groundswell, and people are recognizing that these corporations are making so much profits, it's ridiculous, and denying care. Mm-hmm. And there's so many people that may have insurance, but they're underinsured, and they don't want to go to the clinics or the hospital because it's going to cost them a lot of money. And so we are really continuing to push and fight for this. And I truly believe that we are going to get Medicare for all. We are.
Yeah.
We have to.
It's going to have to happen. There's no question. It's going to have to happen.
Yes.
Cathy, thank you so much for what you do. My gosh, 45 years in the profession and now president of National Nurses United. You got a lot of fight in you. So you stay in touch with us. We talk about these issues every day, Monday through Friday here on America's Workforce. And we're growing. We're the #1 union podcast in America. So it's because of the guests like yourself we bring to the table and speaking truth to power, as we say. You take care. Thank you so much for joining us today, Cathy, and keep in touch, okay?
Thank you. Thank you so very much.
All right, we're going to take a quick break. When we come back, the executive director of the National Labor Office of Blue Cross and Blue Shield. Back in a few minutes. You're listening to America's Workforce.
This is America's Workforce.
It takes LIUNA to build North America's infrastructure. From roads and bridges to schools and skyscrapers, the men and women of LIUNA, the Laborers International Union of North America, build the projects we depend on. From constructing the Freedom Tower on the site of the former World Trade Center to untangling Washington, D.C.'s congested interstate, LIUNA members do the work that matters. Find out what it takes to be built by LIUNA at liuna.org. That's liuna.org.
America's Workforce is brought to you in part by the International Brotherhood of Teamsters, where you can find more at teamster.org. Founded in 1887, the Brotherhood of Maintenance of Way Employees Division of the International Brotherhood of Teamsters represents the employees responsible for tirelessly constructing and maintaining the national rail system in America. For more than a century, the Brotherhood of Maintenance of Way Employees has proven they have what it takes to protect its members and meet the ever-changing challenges of the rail industry. Today, the BMWED continues to fight for job security, fair wages, better benefits, and safer, more modern work environments. For more information, please visit bmwe.org. America's Workforce is brought to you in part by the Ironworkers. You can find more at ironworkers.org.
America's Workforce appreciates our sponsor, the Columbus Central Ohio Building and Construction Trades Council, who represents more than 18,000 workers from 19 affiliated local unions and district councils.
America's Workforce is brought to you in part by the Communication Workers of America. You can find more at cwa-union.org.
This is America's Workforce. More shows available at awfradio.com.
By the way, this next segment is brought to you by Blue Cross and Blue Shield's National Labor Office. You know, Blue Cross and Blue Shield companies formed out of a need to provide affordable health care to teachers, to loggers and miners. Well, in 1965, the Blues developed the National Labor Office to strengthen its commitment to organized labor. Today, Blue Cross and Blue Shield's National Labor Office remains focused on America's workers, advocating for affordable and equitable health care, partnering with strategic alliances to provide industry-leading products and services, and proudly serving more than 18 million unionized workers, retirees, and their families, all working hard for America's working families, for the health of America. You can learn more by following them at Blue Labor on LinkedIn and X, formerly known as Twitter. Well, hello, everyone. I am joined once again today by Merrilee Logue. And for those who don't know, Merrilee is the executive director of the National Labor Office at Blue Cross Blue Shield Association, where she oversees the National Labor Office. Merrilee, welcome back to America's Workforce.
Great to be back, Flash.
So, Merrilee, what topic are we discussing today?
Today, we are going to speak about a topic that is incredibly important
cancer. In the National Labor Office, we are working with labor leaders and look at healthcare trends, and cancer is at the top of the list. While we are not experts in the field, I would like to raise awareness.
Well, I can already sense that this will be a very important conversation for our listeners. So I'm going to turn it right over to you.
That's right, Flash. We all have been touched by cancer, whether it's ourselves or someone we love. Therefore, it's important for people to know what steps they can take to take care of themselves and others.
Well, I completely agree. So, Merrilee, where should we begin?
Let's start with some facts. So in 2024, according to NIH, the National Institutes for Health, over 2 million new cases of cancer were diagnosed in the United States alone. And that number this year is projected to be even higher. Alarmingly, 42% of these newly diagnosed cancers are potentially avoidable. Yet, despite the availability of preventive care, it's increasingly underutilized.
You know, those are some pretty sobering statistics. Now, it's a good thing, very good thing that we're taking the opportunity to educate and provide awareness to our listeners. So, Merrilee, is there any background information you think would be good for our listeners to hear before we jump into prevention and screenings? What do you think?
Sure, Flash. To control cancer costs and help ensure the best outcomes for members, it's more crucial than ever to offer cancer programs that deliver well-managed care across the cancer journey. So it starts with early detection, it extends through diagnosis, treatment, remission, and survivorship. Today, cancer is one of the union's top healthcare expenses, and the trend towards increasing diagnosis means that even more members could currently be living with cancer or could have it in the very near future. So it's important to provide members with the best chance of finding and potentially beating cancer. We all know early detection means a better health for the member and helps the financial health of the fund. Cancer programs that deliver well-managed care have become crucial.
Well, thank you, Merrilee, for cancer prevention. I know a lot of it starts with understanding the risk factors and making healthy lifestyle choices. For example, some ways to avoid that would be simply maintaining a healthy diet, exercising on a regular basis, avoiding tobacco, and limiting alcohol consumption. Did you know that apparently fewer than half Americans realize the effects their lifestyle choices could have when it comes to cancer prevention?
That's so right, Flash. But it seems overwhelming sometimes to even get started for all of us. Understanding things like risk factor is so important for members to recognize, especially since avoiding risks can be incorporated into their daily routines.
Merrilee, I agree. Now, when it comes to guideline-driven and evidence-based screenings, what can you tell us about them?
So cancer screenings are designed to find cancer or precancerous changes in the body, sometimes before symptoms even appear. Allowing for early intervention will potentially give better treatment results. But it's important to know cancer screenings don't diagnose cancer. They are a way of finding out if you could have cancerous cells or early signs of cancer. Shockingly, almost 40% of people decide not to even get screened, despite having widespread coverage and opportunities to get screenings for multiple types of cancer.
That's amazing. Merrilee, why do you think people are not getting screened? I'd like to know that.
So many people choose to avoid screenings because simply they're afraid. Let's be honest, Flash, we all take that what-if journey when we are doing a screening. Another reason is we just don't know which screenings to do. There's so much information out there, it's sometimes hard to know which screenings we should do and how often. Time is also a factor because we all have busy work and family responsibilities. It's hard to carve out time. Lastly, access to screening is sometimes an issue for some. About 65% of people are behind on cancer screenings, meaning they may miss their chance at early detection, and by detecting cancer one stage early, it could triple a member's likelihood of survival and dramatically reduce costs. But it is critical that everyone take the brave step and get their cancer screenings on a regular basis, especially since they are usually covered by their health insurance.
That is a large, and I mean a large statistic of people that are behind with screenings. Now, Merrilee, I know there are guidelines established by the U.S. Preventive Services Task Force. And to make it easy for people, there's an app, USP STF. We can use that app to find out which screenings we each need to do, right?
That's right, Flash. There are basic guidelines, but we always urge members to understand their individual risk factors, which may suggest other screenings. Risk factors are family history or habits or even genetics.
So, if someone is diagnosed with cancer, what are the next steps that should be taken, Merrilee?
Well, Flash, cancer treatment is extremely challenging, both mentally and physically and financially. Making decisions and developing a plan is stressful and confusing, but it's extremely important, especially since treatment decisions affect the rest of the individual's cancer journey. Just remember, there are resources available to help with this journey. A first step would be contacting your health insurance company and the people in charge of your benefits. I've been on your show before speaking about my own cancer journey and believe that having a few people to help navigate this is critical. I call them the posse. They could be the fund office, your spouse, a friend. It's entirely your choice.
All right, Merrilee, you know this is a union show. I have to ask you, what do you think unions could do to help during this?
During life's stressful moments, we've seen that many members turn to their unions for support. It's a place where unions can help in navigating care, from preventive care through treatment and afterwards. They can have educational materials readily available in the fund office, hold educational sessions virtually or in person. I've even seen many unions have wellness barbecues. If the fund's cancer costs are high, they may even want to invest in a more robust program, or their plan may already have one. Implementing a comprehensive cancer care program connected to a well-established and highly vetted centers of excellence will get their members to the right care when they need it most and provide continued navigation support and treatment guidance, especially through remission. For Blue Cross and Blue Shield companies, we have what we call our Blue Distinction programs, and they are located across the country.
Boy, I'm glad you mentioned that support is there even through remission, since the journey doesn't just end when the treatment is done, right?
Exactly. Unions have the opportunity to guide survivors into management support systems that can help keep them on track with ongoing scans, routine screenings, and a variety of mental health needs.
So, in order to create awareness for cancer and cancer prevention, what is your team at the National Labor Office currently doing?
We recognize the importance of cancer prevention awareness and have a campaign that aims to provide education and drive awareness of early detection, cancer treatment, and beyond. We're also working together with experts in cancer detection prevention, cancer navigation, as well as union leaders through our Blue Cross Blue Shield local plans to develop campaigns that motivate and activate diverse union populations. The goal is to increase awareness of cancer screenings covered at no cost under the Affordable Care Act, provide education on available resources and risks, and address the psychosocial and mental health hurdles associated with cancer.
You know, it seems like you're doing a lot of great work to create awareness. Is there anywhere you would recommend our listeners go to find out more information for coverage as well as screenings? What do you think?
So for our listeners that are curious about where you can find information and coverage for cancer screenings, they can go to www.cancer.gov or contact their local doctor. I also suggest reaching out to your fund office to see what services are covered. As I mentioned earlier, at Blue Cross Blue Shield, we offer Blue Distinction Centers for Cancer Care, which provide a full range of cancer services and are located throughout the United States, and chances are there are other similar programs.
Well, that's great. And thank you, Merrilee, for joining us once again here on America's Workforce. This was another informative session. So any last words before we leave?
First of all, Flash, thanks again for having me. At Blue Cross and Blue Shield companies, we're dedicated to supporting the American worker and their families so they can live their healthiest life, because healthy members mean strong unions. As for me and my team, we sponsor labor events, conferences, and conventions throughout the year. You can follow us at Blue Labor on LinkedIn and on X, formerly Twitter.
I like that. Healthy members mean strong unions. That's what it's all about. Well, Merrilee, thank you. A big thank you to our guest from Blue Cross Blue Shield Association, Merrilee Logue, for sharing her expertise right here on America's Workforce. That'll be it for another edition of America's Workforce. Tomorrow, we check in with the United Steelworkers and Social Policy Workers United. Until then, all of you have a safe and wonderful day.
That concludes another episode of the America's Workforce Radio Podcast. Thanks for listening, and be sure to subscribe so you never miss a show. America's Workforce is a production of Labor Tools and BMA Media Group. Find out more information online at labortools.com.